The topic that we're going to talk about today is COVID. Now, I know many of us are sick of hearing about COVID and sick of talking about COVID, but I promise that today it's going to be a really interesting discussion, and I promise that we will also leave the call feeling inspired and hopeful that there's some really great work going on all around the world. Each of our project leaders are going to speak for between 4 and 5 minutes about what COVID's meant in their communities, the response that they've done so far, and what they're looking to do in the future with the support that's coming through from all our wonderful supporters across the world. Hello, Robert. Would you like to kick us off? Robert is based in Uganda. Robert is a really strong local leader over there who's doing incredible work for children and also for women in Uganda. So I'd love to invite you, Robert, to let us know what you've done so far for your community and what you're planning to do going forward. And you've got your chicken friend there. It must be early.
Thank you so much, Joe. Allow me, guys, to stand up because I honor you and respect you all for giving me this opportunity to be here. COVID hit us for the first time, and we didn't expect anything to happen. But right now, so many people have learned what they call COVID, because myself have been a victim. And so many people have been dying. I got therapy from Just People's when we had the last interview. So when we had the last interview, I told them what I wanted to do. That was the COVID ready food, so that we can take those communities that I'm supporting so that they can have something. These are people coming from urban centers, from urban areas and rural communities. With all your support, we managed to reach out to 186 families. These are families that are including children, headed families, girls and young women, elderly families, and people with disabilities. Ladies and gentlemen, I'm very happy because these people were very happy because we had even a chance of having a person with disability dancing after receiving the food because she could not expect this opportunity. But right now, my focus today is to look at where we are going ahead, especially in the community of Bushra Island. Bushra Island, the community I'm talking about, it has over 20,000 people. But this is an isolated area. When they had the first COVID personnel, that was the first lockdown we had, it took the government about 72 hours to evacuate that person. It has been very difficult for the government even to reach out because this is an isolated island within Lake Victoria. So what are my suggestions to do there? Because these are people, they don't know, they don't understand what COVID is all about. So this time we suggested to see that we can do sensitization within the community so that we can help these people understand what COVID is all about and to know that COVID is a serious killer. Secondly, we want to reach out to these people with hand washing facilities operated by foot, whereby you just press it and it brings water and you're able to wash your hands so that you don't spread that virus to other people. These are things that are not there or are not existing in that area. We also want to extend reusable face masks because it is very hard for them to access the medical masks, which they sell and use it once and throw away. They can't afford that because of the current economic situations. The other thing was for the motorbike ambulances, because right now they're in a very remote area and the path, they don't have actual roads, I can say. They're just pathways. What they use basically there is motorcycles. A vehicle cannot reach there. We use the boats to cross, and then the other end, we use the motorcycles. So in the future, I was also planning to have a motorcycle ambulance, which is modified for the pathways that they have, so that these people, when they get a problem with maybe a COVID patient or be able to move to very fast, they can have this motor ambulance so that they can evacuate them to a nearby hospital or any other health centers. So ladies and gentlemen, these are some of the things that I want to do so that I can help these people prevent and even help them access a hospital where necessary or where they can. I'm very grateful to speak to you today, to present what I'm planning to do. We believe, hopefully, when we're working with you, we shall overcome it with everyone. So ladies and gentlemen, I thank you all. Thank you for listening to me.
You're wonderful. Thank you so much for sharing, Robert. It's really eye-opening to hear the different challenges that are faced, especially in communities that are so remote and unable to access medical care and even running water. So those hand wash stations are so essential so that everyone can maintain the hygiene. I don't know, Liz actually might talk a little bit about the change that she's seen in the Maasai communities after installing hand wash stations, because it's very, very cool. Like beyond COVID, the changes that she's seen after changing their behaviour to hand washing, even in places without running water. So thank you so much, Robert. Hong, would you like to go next?
Yeah.
So Hong built and nurtures a community of thousands of single mothers living in Vietnam and supports them in a variety of different ways through trauma therapy, through helping to set up businesses, economic empowerment, emergency cash transfers. Hong has supported this community amazingly through COVID so far, despite facing some really the most serious lockdown I've ever heard. So Hong's going to share some of that experience with you and what she's planning to do next, which is really, really exciting, actually thinking beyond COVID and how to rebuild the economy amongst your community going forward.
You guys may see somewhere else in India or Korea or Italy, maybe you've never seen anyone military involved in controlling the COVID in a very strange way. And people die on streets not because of COVID, but because they cannot get food to eat due to lockdown. There's many single mothers in our community got COVID and have to stay at home as well, take care of themselves and also their kids. So we form an emergency online group to support them with guidelines, how to take care of themselves, how to breathe, how to eat, and how to take medicine and what kind of medicine to take, etc. And they don't have ventilator to support with breathing. So breathing is very important that they have to practice how to do that. Such people advanced 2,000 for us to buy medical food, vitamin, etc. to support these first 15 women. Indeed, this morning, as I read the report, 4 of them already recovered from the COVID, which made me very happy, proud, very grateful for those people and your donors that support us in a very in-time and flexible way. We still have, for now, 12 more women that got positive to COVID this week, and they are learning to take care of themselves on our group. However, we're looking to support them with medical food and other things that they need to overcome the COVID. In the other hand, we hope to raise more funds to continue to maintain the growth of the community of more than 1,000 members that we've been building so far by organizing talk show, live stream learning, online learning, training to support them adapt with the COVID, control their mental health and health during COVID, as well as to prepare for the life after COVID. We hope to build a small community of leaders who are single mothers, who then will lead other single mothers in doing business. And then little by little, we can be stronger and sustainable and scalable by ourselves. So that's my sharing from what I'm doing right now in Vietnam. And thank you for listening.
Thank you so much, Hong. I'm really inspired by the way that you design and deliver your projects to, even in an emergency response, to always have that element of sustainability. I think we sent maybe $1,000 US at the very start of the pandemic, and that was for cash transfer loans. And then that was like basically seed funding. And then the women, part of Hong's community were then lending money to each other when they needed support. So it's something really special the way you can build that community. And I'm really excited to see what you can do in that road to recovery after COVID and that really holistic kind of support with psychological, helping them to build businesses and employ each other. Amazing. I love your work, Hong. It's a real privilege to learn about it and to be part of it. Next, we are going to hear from the lovely Liz. Liz does some incredible work in Kenya, working with Maasai communities, they're pastoralist communities that live very, very remotely. And I will let Liz tell you more about the work that she's been doing to reach them with information and protection from COVID. Welcome, Liz.
Thank you. Hello, everyone. I'm Liz. I'm a physiotherapist doing private practice, and COVID has hit me personally because I do home-based therapy to my clients. I've lost this year I've lost about 5. Last year I lost about 3. So that has definitely affected my financial ability because that's how I survived. But on the positive, it has given me a big thank you to Just People's big time, because fundraising has been coming in. And as a result, it has made me concentrate on what I love best, sharing my skills, knowledge, and attitude to the people who need it most. And that's the Maasai community I work with. I work with mothers and children living with disability who are under the care of their mothers or caregivers. So what had been happening with COVID? They are a pastoralist community, and I just love doing community-based rehabilitation. So I go and reach out to them, look for them, because they're still hidden even at this time and age, which is probably a nice thing with COVID. They've been quarantined, and that quarantine has kept them safe. And what we've been doing with Just Peoples is we began by providing hand washing stations, and we gave the mothers a training on what is COVID and why they need to protect, because the whole world out there will say the vulnerable are at risk of COVID, but the word disability never gets factored in. So I am the champion who brings out the issues and says, yes, even disabled children are as vulnerable as the elderly, as those ones with underlying conditions. So we took the mothers through a training on how they can prevent themselves and the children they're taking care of on how to prevent COVID. And initially our first interventions was hand washing stations, and we always had high nutritious food so that the babies who have a hard time even feeding, and also the mothers, because you realize mothers naturally put their children first. So for a mother with a disabled child really goes right at the back, and you find the mother is also weak. So initially it was taking the food for the children, but we always factor in the mothers who take care of these children, because you need a strong mother to take care of a weak child. So the first training, we went and we did hand washing. We provided them with soap that would carry them through. We bought them bar soaps, because that you can cut in small pieces and they can use it for washing. It was a thrill, because in Maasai, water is for cooking and drinking. So now it was interesting to watch the hand washing stations, run water and wash their hands. So it looks like a nice thing. It's like if you bought me an iPhone, I would be on cloud 9. So having the hand washing, well, that's what it meant for the mothers. And when I went, I think 2 weeks after, they had turned the hand washing stations to clean water drinking facilities. So, okay, I was caught between, all right, do I allow them to wash hands or do they use it for clean drinking water? So definitely that was a need that then I realized we probably needed to give each mother two, one for hand washing and one for use as a clean drinking water. What has this brought in? There were always cases of diarrhea, and because of the little hygiene for the mothers or caregivers, not cleaning their hands when they want to give food to their babies. Now, for the first time, we had very little reportings of children getting stomach infections and diarrheas and vomiting, because this is really caused by poor hygiene. So that was a big win, that COVID brought in this other whole thing on the benefits of hygiene. Also, the use of masks, because we always provide 3 masks to the mothers whenever we go on the ground. And we've always told them, if someone has a flu, a cold, use a mask when you're handling the child so that you prevent any infection. If in that case, it could be COVID. As a result, we're able to prevent transmissions of things like tuberculosis. So it's a huge plus. We've seen healthier babies. I'm really happy to report we haven't lost any child in our program because of COVID. And if anything, they are much more healthier in the regards of overall health. So the next big thing that came in is studying our community. The mothers hardly live where they stay. It is the men who move out for grazing. It's the men who go to the urban centers, and it's the urban centers that bring in the COVID. So we had this thing of, can we involve the men? But coincidentally, we also needed to bring in the men so that they can support their wives, their daughters, their mothers with accommodating children with disabilities. We targeted men in different locations in our community, and COVID made us delay because we would be denied gatherings, which are for obvious reasons. But I'm happy to report that last month, we were able to complete seeing a total of 200 men. And we did huge medical camps with the local doctors, because we are getting them on board so that it becomes a community-owned based project. And we had very interesting findings and reactions, because the men were very happy. It's nice when you're a medic and you're carrying out a process and a project, because they become complacent. They want to listen to you because you have information. So the men, which was interesting to see them all mask up, There were two blind men in one of the projects, and you see the young one trying to help the blind man put the mask in the correct way. And then through the trainings, I remember we were highlighting underlying conditions and why they need to take general good health as an important thing to prevent COVID. It was a very interesting intervention and bringing in health education to people who don't even have basic education. So giving the right information, emphasizing on the need of vaccines, and above all, emphasizing on why health should be a collective responsibility. And it's been nice because now, as a result of the men camp, we have identified 20 more babies who had never been in our program. And that's such a win. And they even said, can you reach out to our women? Can you reach out to our children? And we said, yes, that's the plan. And they're like, this is the first time someone has thought about us men. We are happy to get all the medication we need. And it's something we'd love to continue doing, because once you bring in community health, then the voice is louder. And once you have the men involved, they really feel, okay, so COVID has opened that avenue, because we're able to even bring in the whole of issue of disability with much more easiness. Because when you talk about general health, you then pick and talk about anything.
The work that Liz does, it always blows me away the way how well thought through it is to ensure that you're bringing all of the community members on board in the way that you need to, that's appropriate to the culture to actually create that behavior change. And it's really cool that you've used that opportunity of COVID, and it's actually really helped for so many other health issues as well. It's brought health to the forefront, which is really, really awesome. Well, I'm not sure if you mentioned it, Liz, but it's a bit taboo in the Maasai culture to have a child with a disability. So the reason that they're hidden away is because you usually wouldn't bring those children out of the house generally. Is that right, Liz? So what Liz is actually doing when she brings a mosquito net for these children, she's showing the whole community that these kids are special, which actually changes the mindsets of children living with disabilities and how they get treated and the stigma. So it's just unbelievably powerful work, Liz, and thank you for doing it. You're wonderful. Bushra and Mushfiq, would you guys like to go next? So Bushra and Mushfiq are local Bangladeshi scientists, inventors, adventurers, problem solvers, always fixing something, building something, making an incredible difference in the community. So it was no surprise to us when, as soon as there was even a whisper of COVID, they were already 3D printing ventilators, PPE, all sorts of things. I'll let you guys share a bit more about what you do, but yeah, amazing work, amazing work.
Thank you. Thank you so much, Joe. My name is Bushra and this is Mushfiq, and we're husband and wife doing COVID response for a while now, and it's been pretty rewarding. To give a little bit of context, I think when the 2020 pandemic hit last year in Bangladesh in the middle of March and everything went under lockdown and everything sort of closed down, there were hundreds of thousands of people who were starting to get infected and contracting COVID, and they were trying to get into the hospitals, get admitted and get some treatment. But the major problem there was that there was no absolutely whatsoever supply of any kind of PPE or any kind of protective equipment or anything at all for the doctors and the nurses and other healthcare workers who were actually in the hospitals. And as a result, what happened that out of fear for their own lives, a lot of doctors and these healthcare workers actually stopped coming to the hospitals and treating patients, which created a very, chaotic environment, because there were patients who were waiting to get treated and then there were no doctors or nurses. So that's when the problem actually started. And when we thought that out of all the things that we do, we could also invest a little bit of time to do the COVID responses. And we were saying that we had a bit of work going on, and then we actually were talking to Joe and Christy and talking about what we could be doing in a situation or a scenario like this. That's when, through their help, initially we actually started the entire 3D printing and producing face shields and the PAPRs that we will show you momentarily. So what we've done so far is that we've produced more than 2,500 face shields that we have distributed to the healthcare workers and the doctors. And we've also made PAPRs for more than 100 doctors at this point, and that has been through the help of Just Peoples. And the ratio for doctor to patient here in Bangladesh is 1 to 1,000. So you can only imagine the kind of traffic that each doctor has to face when it comes to to taking care of people. So we're just really glad that through this help, we've been able to help out these healthcare workers. And since the third wave is going on in Bangladesh, and there's a lot more doctors who are in need of these. So we just appreciate a lot of your help in however way you can help out. And I'll let Mushfiq explain to you the rest.
Hi guys. So just to continue in the context of what Bushra has been mentioning is that, so I remember being in a call with Joe and Christy back in March 2020, and we were talking about how or what we could do to help. And we really didn't have a clear plan back then that what we were going to do, but we knew that the condition in Bangladesh was dire. We knew that Bangladesh had the highest death rate of doctors in the world, and we knew that there were thousands of people flocking hospitals in Dhaka, and no one knew what to do basically. So I remember getting a few 3D printers with help from Just Peoples, and with that we started printing face shields. So we turned my small bedroom into a small lab, and we were cutting plastic sheets, we were punching holes on the plastic sheets, we were making the headbands for the face shields. I did around 800 face shields with my own hands, and then I had 2 or 3 volunteers from my team who also helped, and we did around between 2,500 to 3,000. The best thing is that each face shield went to one doctor. Because of this, we knew that doctors were finally being able to see hundreds of patients every day. And I'll just show you this. So this is what we then came up with. So this is a normal scuba mask that you guys are aware of. So we basically did a 3D printed adapter for a scuba mask. You put that onto the scuba mask like this. It just snaps on. You put a filter over here, and this replaces the doctor's face shield, face mask, and goggles. So it replaces 3 things which are disposable and which in Bangladesh the doctors have to buy with their own money. So getting one of these means that the doctor can do a long-term protection and they can serve patients for a longer period of time. And this is completely reusable, which means they can clean it, disinfect it, and then keep using it day in and day out. So because of this, we were able to give around 100 of these with Just People's help, and we're still giving them out in some of the most rural places in Bangladesh right now. And all of our hospitals are based in Dhaka. So outside Dhaka, you'll only see very, very small clinics. There are no proper hospitals. So there is no proper response outside of Dhaka. That's why we are trying to go outside of Dhaka to these clinics and to these doctors to try to give them any protection at all, because even if they want to pay for protective equipment, they can, because they still don't have the supply for it. So which means that this is the only bit of protection keeping the doctors alive. And COVID for us has been a very personal experience, because I personally lost my grandfather who was very close to me. And during that time, I was at the hospital for around 20 days next to him in the ICU. And I saw approximately 30 to 40 people die in front of my own eyes, because there are no curtains or anything. It's like a big room with a lot of patients. So I knew what it felt like to see the relatives come in every morning to collect dead bodies and not being able to touch the dead bodies because of COVID. So it was a very traumatizing experience, but being at the hospital with my grandfather also showed me what the doctors were going through during that time. And I saw that they were trying, but they didn't have anything to try with. They didn't have the proper medications. They didn't have anything proper at hand to do any form of help. And that's when I thought I need to ramp up this project, and I need to help more doctors to make sure that people like my grandfather, they are dying all over the country. So they will be served better, because doctors will be happier, they will be more confident serving more critical patients. So that was one of the main motivations for all the work that we have done. And just last word is to thank every one of you. You have been great. And just because of your help in Bangladesh, we're the only ones who are being able to do this, produce, customize 3D printed PPE. It's surreal for us. And thank you for all the support you have given us. I hope you keep supporting us.
Thank you both so much. You guys are so inspiring, and my heart goes out to you for all the personal loss that you guys have both been through over the last couple of years, and to know that you've used that as a driver to make sure that other people and other families don't have to go through the pain that you guys have both been through is amazing. And they got married in the middle of this pandemic as well, which was a very, very special and happy moment. I think I was riding my bike when you told me I nearly fell off my bike. Christy and I were absolutely freaking out. So got a serious Bangladeshi power couple here. And I'm really, really pleased that Jeremy and Steve and Lauren are here to hear from you directly, to meet you after supporting your work, and to really understand the impact that they've made by supporting what you guys do. So thank you so much for sharing, guys. And last but not least, we have Beth. Beth is based in Kenya as well. And Beth has been working really hard to bring clean drinking water to hundreds, probably thousands of families within Kenya. And she's now looking to do a COVID response in Kenya as well, which I will let you share, Beth.
Thank you so much, Joe. And I would like to say I'm very inspired by the other project leaders on the work that they are doing. It's quite humbling. And at this moment, I feel like everybody has been affected by COVID directly. Me, this year, my dad got COVID and he was in ICU for some time. We are very lucky because despite him being diabetic, he pushed through and he just had kidney failure. We are very thankful that he's alive. And this is not very new to our family. I think most families have been affected in one way or the other. And right now, Kenya, we're in the third wave. And I think it's compulsory for people to wear a mask when you're in public. And the most common masks are these. And they're quite cheap. I think they're like 10 shillings. That is like 10 cents USD. But you have to change it every few days. And I would say it's quite uncomfortable when you're doing manual work or when you're doing heavy work. I'm part of an organization called the Royal Academy of Engineering. So they have this amazing design for a mask, which is basically 3D printed, and who are always in mask, like 12 hours a day, or people who work in construction or doing a lot of manual work. And here's the mask. I'll just give a description. So this is how you wear it. I would say it's not a very pretty mask. As you can see, it's quite long, but comfortable and easy to breathe in. So the mask has 3 parts. So this is the one part. So there are these other 2 parts, which you have to take apart. So this is actually the filter itself, which this is the only part you change actually. So this you can wash and disinfect, but this you have to change almost daily. And what we did in terms of this, so we have these filters that we are using. So as you can see, they are 3 layered. Each part is 3 layered. As you can see, I don't know if you can see clearly. So this mask, when we are distributing this mask, we give out 6 months worth of filters. As you can see, this is a very, very simple design that you basically 3D print. So at the moment, we are in the process of getting certified, and the trade-off for this mask, this space between the filter itself and your mouth and your nose, it's quite long, so it gives you a bit of space for you to breathe in. So they are actually very comfortable. We're in the process of getting certified by the Kenyan standard. We will distribute a few of them in hospitals, mostly public hospitals. So Kenyatta National Hospital have a lot of interest, but also people who are doing a lot of intensive work, the manual work that need a lot of comfortability. Thank you.
Awesome. That's so cool. Thank you. I'm sure that Bushra and Mushfiq are dying to have more chats with you about 3D printing. I love the innovation. I love the fact that the news that we hear is about shortages of PPE and things like that. And to know that you guys are taking that into account, you're getting these designs and able to 3D print them to make sure that you're still able to supply your communities is awesome. So great. And I'm looking forward to hearing the process and getting the certification and things like that so we can get moving and get these masks out there. Thank you so much, Beth.
And thank you to everyone who has shared your work today. We really appreciate taking the time when everyone's so busy. So it means a lot that you all make the commitment to come here today, and have a great rest of the day and night. It must be about 1:30 a.m. or 2:30 a.m. in Mexico. So big effort for Juan. Well done. A lot of people have had an early morning in East Africa as well. So we'll let you go. But yes, thanks again. And here's hoping this pandemic finishes so that everyone can get back to life as normal. But in the meantime, we really appreciate hearing the different stories from the different communities that you all work in. So goodbye.